Question 36. An SP technician is participating in a departmental cross-training workshop alongside colleagues from diverse cultural backgrounds and varied levels of experience, physically demonstrating and sharing unique instrument assembly techniques. By actively valuing these diverse perspectives during the physical hands-on training, the department achieves which combined outcomes? A. Increased creative problem-solving, a culture of respect, and decreased absenteeism. B. The complete elimination of all manual documentation errors on sterilizer printouts. C. Automatic compliance with all physical environmental air exchange regulations. D. Guaranteed immediate supervisory promotions for all workshop participants. Correct answer A. Knowledge point explanation. Core rationale. Diversity in the workplace involves valuing different backgrounds and experiences. When a department embraces this, staff feel respected and included, which directly improves job satisfaction and lowers absenteeism. Furthermore, merging different viewpoints leads to enhanced creative thinking and better problem-solving strategies for physical workflow challenges. Trap analysis. Option B. Human error can never be completely eliminated through diversity initiatives alone. This option would be correct if describing the primary benefit of replacing handwritten logs with a fully automated, integrated barcode tracking system. Option C. Air exchange rates are dictated by mechanical engineering and HVAC systems, not interpersonal relationships. This option would be correct if the facility just installed a brand new, high-capacity ventilation blower in the decontamination area. Option D. Promotions must be earned through demonstrated competence and leadership, not merely by participating in a workshop. This option would be correct if the scenario described a fictional, legally binding contract that unconditionally mandated career advancement based on seniority. Concept extension. Strong human relations skills, including embracing diversity, are heavily emphasized by the Healthcare Sterile Processing Association as they are essential for navigating the high-stress, cross-functional interactions between sterile processing and the operating room. Question 37. While cleaning a massive chemical spill caused by a dropped gallon of glutaraldehyde, an SP technician rushes to the department's yellow safety binder to identify the exact hazardous ingredients involved. According to the specific workbook standard, the technician must physically turn to which exact section of the safety data sheet to locate this chemical breakdown? A. Section 2. B. Section 4. C. Section 6. D. Section 8. Correct answer A. Knowledge point explanation. Core rationale. A safety data sheet is a standardized document detailing chemical risks. According to the specific text referenced in the HSPA workbook, Section 2 is dedicated to hazards identification, which outlines the hazards of the chemical and the hazardous ingredients present. Trap analysis. Option B. Section 4 outlines first aid measures. This option would be correct if the technician had accidentally splashed the glutaraldehyde into their eyes and needed to know how long to utilize the eye wash station. Option C. Section 6 outlines accidental release measures. This option would be correct if the technician needed specific instructions on what physical absorbent materials to use to contain and mop up the puddle on the floor. Option D. Section 8 details exposure controls and personal protective equipment. This option would be correct if the technician needed to verify if a specific respirator was required before re-entering the spill area. Concept extension. It is a violation of federal OSHA right-to-know laws if these safety data sheets are locked away or inaccessible to technicians during any point of their physical shift. Question 38. After successfully earning their certification, an SP technician sits down at the break room table to physically write out a 5-year professional timeline aimed at becoming a department manager. To ensure this written career plan is realistic and achievable, the technician must physically incorporate which critical understandings into the document? A. Realizing promotions take time, anticipating unexpected delays, and recognizing varying goal difficulties. B. Understanding that management roles mandate a doctoral medical degree. C. Assuming the facility automatically grants a higher salary every 6 months. D. Accepting that continuing education requirements are waived for leaders. Correct answer A. Knowledge point explanation. Core rationale. Developing a professional timeline requires a realistic approach to career advancement. A technician must understand that climbing the hierarchy takes time and practical experience, that some objectives are physically harder to achieve than others, and that unforeseen personal or departmental setbacks will require flexibility in their plan. Trap analysis. Option B. A medical degree is not required for sterile processing management. This option would be correct if the technician was plotting a timeline to become a licensed orthopedic surgeon. Option C. Salaries are typically tied to performance, budget, and promotions, not automatic guaranteed timelines. This option would be correct if the technician was reading a highly specific, union-negotiated contract that strictly mandated biannual step increases regardless of merit. Option D. Continuing education is mandatory for all certified personnel, including management. This option would be correct if the technician was planning to surrender their certification and permanently retire from the field. Concept extension. A realistic timeline should include measurable physical milestones, such as completing a specific number of continuing education units per year or successfully mastering the operation of the ethylene oxide sterilizer by a certain date. Question 39. A facility's SP educator is updating the physical training logs in the department's filing cabinet. They are scheduling hands-on competency demonstrations for a recently hired employee and for a veteran decontamination technician who just officially transferred into the sterile prep and pack zone. According to regulatory standards, formal documented training must be executed for which specific group of personnel? A. Exclusively for newly hired staff members entering the facility for the first time. B. Strictly on a monthly basis for all active personnel regardless of their current role. C. Exclusively for veteran employees who are transitioning into a completely different operational position. D. Both the newly hired personnel and the existing employees transferring to new departmental positions. Correct answer D. Knowledge point explanation. Core rationale. Quality and safety standards mandate that comprehensive training is not just for new hires during their initial orientation. Any time an existing employee moves to a new physical workstation with different equipment and protocols, they must receive and document specific training for that new role before working independently. Trap analysis. Option A. Restricting training to new hires ignores the critical knowledge gap of veteran staff taking on unfamiliar tasks. This option would be correct if the question asked who attends the mandatory hospital-wide human resources orientation on their first day. Option B. Monthly formal training is not a universally mandated standard. This option would be correct if a specific facility wrote an internal policy explicitly requiring a physical fire drill every 30 days. Option C. Restricting training to transferring veterans leaves new hires dangerously untrained. This option would be correct if the scenario asked who requires cross-training documentation specifically after mastering their original assigned workstation. Concept extension. In addition to initial and transfer training, all sterile processing technicians must undergo an annual physical competency review to prove they maintain the skills necessary to safely operate all processing equipment. Question 40. An SP technician is assigned to physically audit 5 randomly selected orthopedic trays assembled by their peers, checking for missing indicators and misaligned instruments, and then logging this data into a continuous tracking spreadsheet. The technician understands that this repetitive, data-driven physical auditing activity is the core definition of which specific departmental process? A. Finding a singular, immediate solution to eliminate an identified root cause. B. The ongoing process of measuring and maintaining the standard of quality output. C. Executing a rapid, temporary fix to bypass a broken piece of equipment. D. Performing the mandatory annual preventative maintenance on a washer disinfector. Correct answer B. Knowledge point explanation. Core rationale. quality monitoring is not a one-time event. It is the continuous, ongoing process of collecting physical data to ensure that the department's output consistently meets required standards. Auditing trays directly monitors this quality and identifies long-term trends where the physical process can be improved. Trap analysis. Option A. Eliminating a specific root cause is part of a reactive root cause analysis after an adverse event. This option would be correct if the technician was modifying a workstation lighting fixture because a dirty instrument slipped past inspection. Option C. A temporary fix is a short-term workaround, not a quality measurement process. This option would be correct if the technician was using heavy-duty tape to temporarily seal a cracked plastic bin until a replacement arrived. Option D. Preventative maintenance is the physical servicing of machinery to prevent breakdowns. This option would be correct if a biomedical technician was physically replacing the worn-out spray arms inside the mechanical washer disinfector. Concept extension. If the quality monitoring spreadsheet reveals a consistent spike in missing chemical indicators, the management team can proactively schedule a targeted in-service training session to correct the physical behavior before an unmonitored tray reaches the operating room. Question 41. An SP technician is physically pushing a closed transport cart loaded with sterile peel pouches from the central storage racks down the service elevator to restock the emergency department. What is the specific logistical term used to describe this exact physical movement of supplies from one point to another within the healthcare facility? A. Internal supply distribution. B. Comprehensive inventory management. C. Case cart system configuration. D. External vendor procurement. Correct answer A. Knowledge point explanation. Core rationale. Distribution is the specific logistical process of physically moving medical supplies and equipment from a central storage location to the specific end-user departments where they will be utilized. Trap analysis. Option B. Inventory management is the overarching administrative system of tracking stock levels and ordering. This option would be correct if the technician was using a computer terminal to count how many peel pouches remained on the shelf to determine if a reorder was necessary. Option C. A case cart system is a specialized delivery method specifically grouping items for individual surgical procedures. This option would be correct if the technician was gathering highly specific instruments and drapes for a scheduled knee replacement surgery. Option D. Procurement is the administrative purchasing of supplies from outside companies. This option would be correct if the department manager was signing a purchase order to buy new transport carts from a manufacturing vendor. Concept extension. Efficient distribution methods ensure that critical areas like the emergency room never run out of life-saving consumable items while simultaneously preventing excessive overstocking on the unit floors. Question 42. An SP technician receives a used intravenous infusion pump transported from an intensive care unit. Even though the device looks physically pristine and lacks any visible blood or fluid residue, how must the technician strictly classify and physically handle this returned equipment? A. As a highly sterile device. B. As a functionally clean unit. C. As a biologically contaminated item. D. As a visibly soiled instrument. Correct answer C. Knowledge point explanation. Core rationale. The golden rule of infection prevention dictates that any patient care equipment that has been dispensed and placed in a patient room must automatically be assumed to be biologically contaminated with microscopic pathogens, regardless of its visual appearance. Trap analysis. Option A. Sterile means completely devoid of all microbial life. This option would be correct if the technician was removing a brand new, unopened infusion pump tubing set directly from its sterilized manufacturer packaging. Option B. A clean device is one that has already undergone the formal decontamination process. This option would be correct if the technician was storing the pump in the equipment room after thoroughly wiping it down with an approved chemical disinfectant. Option D. Visibly soiled implies gross, observable dirt or blood is present. This option would be correct if the scenario explicitly described the technician receiving a pump that was covered in sticky, dried liquid medication spills. Concept extension. Because the item is deemed contaminated, the technician must physically don appropriate personal protective equipment, including gloves, before touching the pump to transport it to the decontamination cleaning sinks. Question 43. While manually scrubbing a delicate microsurgical scissor at the 3-compartment sink, the SP technician must utilize a specific liquid cleaning solution that physically removes bioburden without chemically destroying the instrument's protective chromium oxide layer. Which specific acidity level must this manually applied detergent possess? A. A highly acidic low pH level. B. A highly alkaline high pH level. C. A strictly neutral pH level. D. A fluctuating temperature-dependent pH level. Correct answer C. Knowledge point explanation. Core Rationale, a neutral pH detergent, measuring between 6.5 and 7.5 on the pH scale, is the absolute standard for the manual cleaning of surgical instruments. It is chemically gentle enough to protect the delicate passive layer of the stainless steel while remaining safe for the technician's physical exposure at the sink. Trap analysis. Option A. Acidic cleaners are highly corrosive to metal. This option would be correct if the technician was performing a specialized, highly controlled stain and rust removal process on a heavily pitted retractor. Option B. Alkaline detergents are extremely aggressive and used to break down heavy soils mechanically. This option would be correct if the technician was pouring detergent into the dosing reservoir of an automated mechanical washer disinfector equipped with a neutralizing rinse cycle. Option D. The pH level of a detergent is a fixed chemical property, not one that randomly fluctuates based on water warmth. This option would be correct if the scenario asked what physical parameter determines the activation speed of a biological enzyme additive. Concept extension. Many neutral pH detergents are formulated with enzymes to actively dissolve complex organic proteins and lipids that cannot be easily removed by neutral surfactants alone. Question 44. An SP technician is physically analyzing a crushed biological indicator vial extracted from a completed steam sterilizer load. The technician knows the living spores inside this specific test vial belong to a highly heat-resistant microorganism. Which specific bacterium, scientifically categorized as gram-positive, is utilized in this physical vial rather than a gram-negative pathogen? A. Escherichia coli. B. Geobacillus styrothermophilus. C. Klebsiella pneumoniae. D. Pseudomonas aeruginosa. Correct answer B. Knowledge point explanation. Core Rationale. Geobacillus styrothermophilus is a highly heat-resistant, gram-positive, spore-forming bacterium. Because its physical spores can survive extreme heat, it is the universal biological standard used to challenge and verify the lethal physical parameters of steam sterilization cycles. Trap analysis. Option A. Escherichia coli is a gram-negative bacterium. This option would be correct if the scenario asked to identify a common pathogen causing severe intestinal illness stemming from fecal contamination on improperly washed hands. Option C. Klebsiella pneumoniae is a gram-negative bacterium. This option would be correct if the technician was reviewing infection control charts regarding a pathogen notorious for causing healthcare-associated respiratory tract infections. Option D. Pseudomonas aeruginosa is a gram-negative bacterium. This option would be correct if the scenario asked to identify a resilient waterborne microbe that aggressively forms biofilm inside the wet lumens of improperly dried endoscopes. Concept extension. Identifying whether a bacterium is gram-positive or gram-negative physically relates to the structure of its cell wall, which dictates how the microbe will absorb specific blue or red laboratory dyes under microscopic examination. Question 45. An SP technician accidentally touches a contaminated stainless steel cart handle in the decontamination area with a bare hand, subsequently scratching their eye and physically transferring infectious microorganisms to their own mucous membrane. In this specific chain of infection scenario, the inanimate metallic cart handle functions exactly as which scientific classification? A. A mechanical transmission device. B. An inanimate fomite. C. A biological human carrier. D. A living insect vector. Correct answer B. Knowledge point explanation. Core rationale. A fomite is the specific epidemiological term for any inanimate, non-living object or substance capable of carrying infectious organisms and physically transferring them from one individual to another. The contaminated cart handle serves as this exact physical bridge in the transmission chain. Trap analysis. Option A. Mechanical transmission device is not a recognized medical term in infection control. This option would be correct if describing a physical pump machine used to push sterile fluids into a patient's vein. Option C. A carrier is a living human or animal that hosts a pathogen without showing symptoms. This option would be correct if the scenario described the technician themselves harboring staphylococcus in their nasal cavity and shedding it onto clean trays. Option D. A vector is a living organism, typically an insect or arthropod, that carries and transmits disease. This option would be correct if the scenario described a mosquito physically transmitting a viral illness through a bite puncture. Concept extension. Because the sterile processing department is filled with potential fomites like sinks, brushes, and computer keyboards, rigorous environmental cleaning and strict hand hygiene protocols are absolutely mandatory to break the indirect contact transmission cycle. Question 46. While actively receiving a post-operative orthopedic set at the decontamination window, an SP technician observes that the surgical staff has wiped down the retractors with a damp sponge and applied a moisture-retaining foam. The technician understands that this immediate physical intervention in the surgical suite was executed to accomplish which primary objective? A. To completely eradicate microscopic microbial life prior to facility transport. B. To eliminate heavy visible organic tissue and prevent subsequent drying. C. To provide a validated method of terminal lethality inside the operating room. D. To significantly elevate the physical operational output of the sterile processing staff. Correct answer B. Knowledge point explanation. Core rationale. Point-of-use treatment, also known as pre-cleaning, is the mandatory first step of the decontamination process physically performed by the operating room staff. Its primary goal is to wipe away gross, visible soils like blood and tissue and apply a hydrating solution to prevent the bioburden from drying and hardening on the instruments before they reach the sterile processing sink. Trap analysis. Option A. Pre-cleaning removes visible soil but does not eradicate all microbial life. This option would be correct if the scenario described the physical function of a dynamic air removal steam sterilizer. Option C. The operating room does not perform terminal lethality procedures on soiled items. This option would be correct if describing the precise function of an ethylene oxide chamber located in the sterile processing department. Option D. While pre-cleaning makes the sterile processing staff's job easier, increasing departmental output is an operational benefit, not the clinical objective of the treatment itself. This option would be correct if describing the ultimate administrative benefit of purchasing a new automated multi-chamber washer disinfector. Concept extension. If gross soil is allowed to dry on stainless steel instruments, the high salt content in the blood will immediately begin to physically corrode and pit the protective passive layer of the metal. Question 47. While sorting soiled instruments at the decontamination sink, an SP technician discovers a stainless steel needle holder covered in a dark, sticky, brown-colored liquid. Knowing this specific skin antiseptic is highly corrosive and causes severe pitting if left on surgical steel, the technician immediately flushes the instrument with water to remove which specific chemical? A. Orthothialdehyde formulations. B. Neutral pH enzymatic detergents. C. Treated reverse osmosis water. D. Povidone iodine topical solutions. Correct answer D. Knowledge point explanation. Core rationale. Povidone iodine, commonly known by the brand name betadine, is a dark brown antiseptic applied to a patient's skin before an incision. If this highly corrosive solution is transferred onto stainless steel instruments and allowed to physically dry, it will rapidly break down the protective chromium oxide layer, causing severe pitting, permanent staining, and structural damage. Trap analysis. Option A. Orthothialdehyde is a pale blue high-level disinfectant, not a brown skin prep solution. This option would be correct if the technician was filling the basin of an automated endoscope reprocessor to disinfect a flexible colonoscope. Option B. Neutral pH detergents are specifically engineered to safely clean surgical steel without causing corrosion. This option would be correct if the scenario asked what specific liquid must be dosed into the ultrasonic cleaner to break down organic proteins. Option C. Reverse osmosis water is a highly purified liquid that prevents spotting and corrosion. This option would be correct if the technician was performing the final manual rinse on a complex orthopedic reamer to remove all tap water minerals. Concept extension. Another highly corrosive fluid routinely used in the operating room that causes severe pitting on stainless steel is saline, which contains high concentrations of sodium chloride. Question 48. While reviewing the sterilization parameters for a completed 270° Fahrenheit steam cycle at the prep and pack computer station, the technician checks the integrated machine gauges. Which of the following printed metrics or devices does the technician classify as a distinct, separate category rather than a built-in mechanical physical monitor? A. The integrated chart recorder logging the 4-minute exposure phase. B. The incubated Geobacillus stereothermophilus vial demonstrating a negative result. C. The live chamber pressure gauge indicating 28 pounds per square inch. D. The digital temperature probe sensor mounted inside the chamber drain. Correct answer B. Knowledge point explanation. Core rationale. Sterilization monitoring is divided into 3 distinct categories: physical, chemical, and biological. Physical monitors are the mechanical components built directly into the sterilizer machine itself, such as dials, gauges, sensors, and printouts that physically record time, temperature, and pressure. A vial containing living spores is classified as a biological monitor, completely separate from the machine's physical hardware. Trap analysis. Option A. A chart recorder is a physical piece of mechanical hardware built into the machine. This option would be correct if the scenario asked the technician to identify the exact physical device that generates the permanent paper cycle log. Option C. A pressure gauge is a physical monitor assessing the internal chamber atmosphere. This option would be correct if the technician needed to physically verify that the deep vacuum phase had successfully commenced. Option D. The digital temperature probe is a primary physical monitor located at the coldest spot in the sterilizer. This option would be correct if the scenario asked what specific physical hardware component dictates when the sterilization exposure timer officially begins counting down. Concept extension. While physical monitors prove the machine operated correctly according to its mechanical programming, they cannot absolutely prove that the steam successfully penetrated the actual surgical packages. This is why chemical and biological indicators are simultaneously required. Question 49. While physically placing a terminally sterilized wrapped basin set onto the 18-inch high wire storage racks, an SP technician visually verifies that the external tamper-evident seals are intact and the wrapper has no tears. Based on modern storage principles, the technician knows this specific package will maintain its sterile status until what exact physical condition is met? A. Until the facility's standardized 30-day chronological expiration deadline passes. B. Until a compromising environmental occurrence physically breaches the protective barrier. C. Until the internal chemical indicator tape naturally degrades and changes color. D. Until the operating room staff transfers the item onto an open surgical case cart. Correct answer B. Knowledge point explanation. Core rationale. The concept of event-related sterility dictates that a properly processed item remains sterile indefinitely, regardless of how much time has passed. The item only loses its sterile status when a specific physical event occurs that compromises the packaging barrier, such as the wrapper becoming crushed, dropped, torn, or exposed to moisture. Trap analysis. Option A. Time-based expiration is an outdated practice no longer used for in-house sterilization. This option would be correct if describing antiquated protocols from decades ago before event-related principles were universally adopted. Option C. Indicator tape degradation indicates poor storage conditions, not the conceptual definition of shelf life. This option would be correct if the technician was discarding a package because it had been improperly stored directly beneath a hot radiant light fixture. Option D. Placing an item on a clean case cart does not compromise the sterile barrier. This option would be correct if describing the final logistical distribution step immediately before the scrub nurse physically breaks the seal inside the sterile field. Concept extension. To support event-related sterility, storage shelves must be physically constructed with solid bottom shelves to prevent dust from being kicked up from the floor and contaminating the lower packages. Question 50. An SP technician is consulting a surgeon's pick list at the prep and pack workstation to assemble instruments for a thyroidectomy. By breaking down the specific suffix attached to the root word for the thyroid gland, the technician physically prepares the tray knowing the surgeon will perform which exact anatomical action? A. The complete physical excision of the targeted anatomical structure. B. The mechanical reconstruction and suturing of a torn ligament. C. The artificial stabilization of a fractured bone using titanium plates. D. The visual inspection of an internal cavity using a flexible lighted scope. Correct answer A. Knowledge point explanation. Core rationale. In medical terminology, suffixes describe the specific procedure being performed on a body part. The suffix ectomy translates strictly to the physical surgical removal or excision of an organ or anatomical structure. Knowing this dictates that the technician must supply instruments designed for cutting, clamping, and removing tissue. Trap analysis. Option B. Reconstruction and suturing utilize a different medical suffix. This option would be correct if the surgical request ended with the suffix raphathy, indicating the repair of a hernia or muscle tear. Option C. Artificial stabilization refers to surgical fixation. This option would be correct if the specific procedure listed on the pick list ended with the suffix pexy, such as an orchiopexy. Option D. Visual inspection indicates an exploratory or diagnostic procedure. This option would be correct if the specific surgical request ended with the suffix scopy, requiring the technician to prepare a complex fiber optic camera setup. Concept extension. Other common procedures utilizing this specific surgical suffix include appendectomy, removal of the appendix, and hysterectomy, removal of the uterus, both requiring the technician to prioritize heavy dissecting scissors and hemostatic clamps in the tray assembly. Question 51. While accepting a heavily soiled neurological loaner set from a scrub technician at the decontamination drop-off window, the SP technician notices several delicate microforceps are tossed haphazardly on top of heavy retractors. Which specific group of hospital personnel bears the ultimate physical responsibility for the proper handling and damage prevention of these surgical tools? A. Only the circulating nurse and the primary surgeon performing the procedure. B. Exclusively the certified sterile processing technicians assigned to the decontamination sink. C. Every single healthcare worker who physically touches or transports the devices. D. The external vendor representative who originally delivered the inventory to the facility. Correct answer C. Knowledge point explanation. Core rationale. Instrument care and damage prevention are universal quality mandates. From the scrub nurse who initially uses the device, to the transport staff, to the SP technician who cleans and sterilizes it, every single person who physically comes into contact with the instrumentation shares the exact same operational responsibility to handle it carefully and prevent mechanical damage. Trap analysis. Option A. Handling responsibility is not limited to the operating room staff, it extends throughout the entire processing cycle. This option would be correct if the scenario asked who is ultimately responsible for calling the final intraoperative safety timeout before making an incision. Option B, limiting responsibility to the decontamination staff, ignores the severe damage that occurs during transport and surgical breakdown. This option would be correct if the scenario asked who is solely responsible for manually dosing the enzymatic detergent into the 3-compartment sink. Option D, the vendor provides the tools but hospital staff assume handling responsibility once the items are received. This option would be correct if the scenario asked who must supply the initial written instructions for use detailing the specific cleaning parameters for the loaned set. Concept extension. Proper handling physically extends the lifespan of expensive surgical inventory, preventing catastrophic intraoperative failures such as a microscissor tip breaking off inside a patient's neurological cavity. Question 52. While navigating the wire racks in the sterile storage room to physically build a surgical case cart for an upcoming total knee arthroplasty, the SP technician relies entirely on a printed pull sheet. This specific departmental document is generated to provide the technician with which exact piece of physical information? A. The precise list of supplies, instruments, and utensils required by a specific surgeon for that exact procedure. B. The step-by-step disassembly and manual cleaning instructions required for the motorized bone saw. C. The chronological layout of the surgical incisions the physician intends to make during the operation. D. The daily inventory replenishment quotas required to restock the facility's central supply shelves. Correct answer A. Knowledge point explanation. Core rationale. Rationale, a case cart pull sheet, also known as a pick list, is a logistical document generated directly from a surgeon's specific preference card. It serves as a highly detailed physical map, listing every single disposable supply, sterile basin, and heavy instrument tray the technician must pull from the shelves to successfully equip the operating room for that exact patient case. Trap analysis. Option B, cleaning and disassembly instructions are found in the manufacturer's instructions for use, not on a case cart pull sheet. This option would be correct if the scenario described a technician reviewing a technical manual while standing at the decontamination sink. Option C, surgical techniques and incision layouts are clinical medical knowledge, entirely outside the logistical scope of sterile processing. This option would be correct if the scenario described a surgical resident reviewing a clinical operative textbook before scrubbing in. Option D, replenishment quotas manage general department inventory, whereas a pick list is tailored to a single, specific surgical event. This option would be correct if the scenario described a technician utilizing a par-level inventory sheet to reorder boxes of biological indicators. Concept extension. If a required item is missing from the physical shelves while checking the pick list, the technician must immediately notify the operating room and actively source a validated replacement to prevent a critical surgical delay. Question 53. Following a complex spinal fusion, an SP technician is preparing to return 3 borrowed multi-tier vendor trays back to the original manufacturer via a commercial ground shipping company. Before physically handing these heavy trays over to the external delivery driver, the technician must ensure the instruments undergo which strict physical processing phase? A. They must be terminally sterilized and sealed with tamper-evident plastic locks. B. They must be thoroughly cleaned and subjected to a complete decontamination cycle. C. They must be sprayed with a saline solution and wrapped in red biohazard transport bags. D. They must be physically sorted by metal type and packed into unsealed cardboard boxes. Correct answer B. Knowledge point explanation. Core rationale. To comply with strict Department of Transportation and Occupational Safety and Health Administration regulations, hospitals cannot ship biologically contaminated items through standard public commercial carriers. Before any loaner tray leaves the facility to return to the vendor, the sterile processing staff must physically route it through the decontamination area for thorough manual and mechanical cleaning to render it safe for unmasked human handling. Trap analysis. Option A. Terminal sterilization is not legally required for ground transport back to a vendor, only physical decontamination is mandated. This option would be correct if the scenario described preparing the complex spine trays to be sent directly into the facility's own operating room for a subsequent patient. Option C. Saline causes severe pitting on instruments, and biohazard bags do not negate the legal requirement to physically decontaminate items before public shipping. This option would be correct if the scenario described a highly discouraged, improper point-of-use treatment by a scrub nurse trying to keep soil moist. Option D. Contaminated medical devices can never be shipped in unsealed, porous cardboard boxes. This option would be correct if the scenario described a technician discarding clean, broken, single-use titanium drill bits into a designated metal recycling bin. Concept extension. The vendor representative receiving the decontaminated trays will not use them on another patient directly. The vendor facility will subject them to another intense inspection and processing cycle before loaning them out again. Question 54. While working at the prep and pack table, an SP technician must physically double pouch a delicate mosquito hemostat to ensure the operating room staff can aseptically present the item onto the sterile field. Which precise mechanical technique must the technician utilize to execute this packaging requirement correctly? A. Fold the unsealed inner pouch in half and slide it tightly into an identical sized outer pouch. B. Seal the item inside an inner pouch, then place that sealed pouch flat inside a slightly larger outer pouch before sealing the outer boundary. C. Place the instrument in an inner pouch, leave both pouches unsealed, and secure the outer pouch flap using chemical indicator tape. D. Seal the instrument inside a paper pouch, then slide it into a rigid sterilization container for the secondary barrier. Correct answer B. Knowledge point explanation. Core rationale. Double pouching requires strict spatial dynamics to allow for sterilant penetration. The technician must completely seal the instrument inside an appropriately sized inner pouch. That entire sealed unit is then placed flat into a sequentially larger outer pouch, ensuring the inner pouch's paper side faces the outer pouch's paper side, preventing folded plastic from blocking the passage of steam or gas. Trap analysis. Option A. Folding pouches creates dense air pockets, and using identical sizes guarantees the plastic will bunch up, completely blocking the sterilant from reaching the instrument. This option would be correct if the scenario described the guaranteed physical method to cause a sterilization failure and generate a wet pack. Option C. Indicator tape cannot create a microbial barrier, and leaving the pouches unsealed renders the item instantly contaminated upon removal from the sterilizer. This option would be correct if the scenario described an outdated, severely prohibited packaging practice that results in immediate patient danger. Option D. Mixing pouches inside a rigid container is an unvalidated practice because the pouch blocks the precise fluid dynamics the container was engineered to manage. This option would be correct if the scenario described placing an individually wrapped screw into a specifically validated, dedicated internal basket meant for that exact rigid container system. Concept extension. When inserting the inner pouch, the technician must orient it so that the open chevron of the inner pouch faces the sealed bottom of the outer pouch, allowing the scrub nurse to cleanly peel both layers open without the inner pouch sliding out onto the floor. Question 55. An SP technician is standing at a well-ventilated soaking station preparing to manually process a semi-critical flexible laryngoscope that cannot physically withstand the extreme heat of steam sterilization. Which specific liquid chemical formulation must the technician pour into the soaking basin to achieve high-level disinfection for this delicate device? A. High-concentration sodium hypochlorite solution. B. Foaming phenolic environmental surfactant. C. Orthothialdehyde immersion solution. D. Iodine-based topical surgical scrub. Correct answer C. Knowledge point explanation. Core rationale. Semi-critical devices contact mucous membranes and strictly require high-level disinfection. Orthothialdehyde is a potent, fast-acting liquid chemical specifically validated for the high-level disinfection of delicate, heat-sensitive instruments like flexible endoscopes, providing excellent material compatibility without requiring tedious chemical activation before use. Trap analysis. Option A, sodium hypochlorite, commonly known as bleach, is highly corrosive and will instantly degrade the delicate optical fibers and metallic joints of a surgical scope. This option would be correct if the technician was donning a respirator to disinfect a massive blood spill on the non-porous linoleum floor of the decontamination room. Option B, phenolics are low to intermediate level disinfectants designed exclusively for inanimate, non-critical surfaces, lacking the chemical power to destroy resilient pathogens on a medical device. This option would be correct if the technician was using a mop to clean the tiled walls and stainless steel prep tables at the end of the daily shift. Option D, iodine is an antiseptic intended for use on living human tissue, not a high-level disinfectant for mechanical instruments, and it will cause severe pitting on steel. This option would be correct if a circulating nurse was painting a patient's thoracic abdomen prior to making a scalpel incision. Concept extension. Before completely submerging the laryngoscope into the orthothalaldehyde, the technician must actively use a test strip to physically verify that the liquid meets the minimum effective concentration, MEC, and ensure the solution is maintained at a minimum of 68 degrees Fahrenheit to guarantee a lethal microbial kill. Question 56. After pulling a hot carriage from the steam autoclave, an SP technician parks it in a designated cooling zone. As the technician monitors the trays, they understand that the required physical duration for the load to reach a safe handling temperature is entirely unaffected by which specific operational detail? A, the physical density and overall mass of the individual metal instrument sets. B, the urgent scheduling demands of a surgical team waiting for the instruments. C, the specific thermal retention properties of the rigid containers utilized. D, the ambient atmospheric moisture levels and thermostat settings of the room. Correct answer B. Knowledge point explanation. Core rationale. Cooling is a strict thermodynamic physical process that relies entirely on environmental and material factors such as the ambient room temperature, the density of the metal instruments, and the type of packaging materials used. The laws of physics cannot be accelerated by human urgency. Rushing this process causes condensation and compromises the sterile barrier. Trap analysis. Option A, heavier mass physically retains thermal energy longer, directly affecting the required cooling time. This option would be correct if asking what specific physical factor causes a massive 25-pound orthopedic tray to require 2 hours to cool instead of 30 minutes. Option C, rigid aluminum containers cool at a vastly different rate than porous paper plastic wrappers. This option would be correct if asking why a sealed rigid bin requires an extended, uninterrupted cooling phase on the sterilizer cart. Option D, ambient room temperature and humidity definitively dictate how fast heat transfers from the hot trays into the surrounding air. This option would be correct if asking why the sterile storage area must maintain strict environmental controls below 75 degrees Fahrenheit. Concept extension. If a technician yields to operating room pressure and physically touches a hot tray to transport it early, their cooler hands will rapidly draw internal steam vapor outward through the packaging, creating a dangerous contamination event known as wicking. Question 57. While physically inspecting the working jaw of a heavy-duty orthopedic rongeur under a lighted magnifier, the SP technician is evaluating the specific end of the instrument that functions farthest away from the surgeon's gripping hand. What precise anatomical terminology dictates this specific location? A, the lateral edge. B, the distal tip. C, the proximal boundary. D, the medial margin. Correct answer B. Knowledge point explanation. Core rationale. In medical terminology, the word distal describes a physical location that is situated farthest away from the point of attachment or the point of origin. On a surgical instrument, the point of origin is the handle held by the operator, making the working tip or jaw the distal end. Trap analysis. Option A, lateral describes a physical location positioned away from the midline, toward the side. This option would be correct if the technician was inspecting the outer side hinge mechanism of a self-retaining retractor. Option C, proximal is the exact opposite of distal, meaning the location closest to the point of origin. This option would be correct if the technician was physically inspecting the finger rings of a hemostat where the surgeon places their hands. Option D, medial, dictates a physical position directed toward the anatomical midline or center. This option would be correct if the technician was evaluating the inner central grooved serrations running down the middle of a surgical clamp. Concept extension. Understanding these directional terms is vital when a sterile processing technician must interpret highly complex manufacturer instructions for disassembling multi-part robotic instruments prior to mechanical cleaning. Question 58. While actively utilizing a specialized nylon bristle brush to manually scrub the internal working channel of a flexible colonoscope, the SP technician must execute the precise leak testing and brushing steps established by which specific professional organization? A. The Society of Gastroenterology Nurses and Associates. B. The Occupational Safety and Health Administration. C. The International Organization for Standardization. D. The Association for Professionals in Infection Control and Epidemiology. Correct answer A. Knowledge point explanation. Core rationale. While general processing standards are maintained by bodies like the Association for the Advancement of Medical Instrumentation, the Society of Gastroenterology Nurses and Associates is the highly specialized professional organization that writes the most detailed, definitive clinical guidelines explicitly regarding the handling, cleaning, and high-level disinfection of flexible endoscopes. Trap analysis. Option B. This government agency regulates physical workplace safety for employees, not the clinical protocols for cleaning medical devices. This option would be correct if the technician was checking the manual to determine what specific chemical-resistant gloves must be worn during the soaking phase. Option C. This global entity creates broad manufacturing and quality frameworks, not specific clinical gastrointestinal procedures. This option would be correct if the scenario asked what organization provides the overarching 9001 quality management standard utilized by the endoscope manufacturing factory. Option D. This organization focuses on overarching facility infection epidemiology, not the physical brush sizes for colonoscope lumens. This option would be correct if the scenario asked which professional body a hospital epidemiologist joins to track nationwide viral outbreak trends. Concept extension. Technicians processing flexible endoscopes must strictly adhere to these society guidelines because the complex internal channels of these devices harbor aggressive biofilms that are exceptionally difficult to physically remove without meticulous, standardized brushing techniques. Question 59. After completely finishing a shift at the decontamination sink and showering, an SP technician physically transitions into the clean preparation and packaging room to begin assembling vascular trays. Because this specific physical workspace requires facility laundered scrubs and a bouffant head cover but no face mask, it is strictly classified as what type of traffic zone? A. A dedicated biohazard containment area. B. An unrestricted public corridor zone. C. A semi-restricted operational space. D. A fully restricted sterile operating theater. Correct answer C. Knowledge point explanation. Core rationale. Infection prevention protocols divide healthcare facilities into traffic zones based on cleanliness requirements. The clean assembly area of the sterile processing department is designated as semi-restricted. This physical classification mandates that personnel don specific surgical attire and head coverings to reduce shedding skin and hair, but it does not mandate the use of surgical masks. Trap analysis. Option A. Biohazard zones handle grossly soiled items and require heavy fluid-resistant gowns and face shields. This option would be correct if the technician had just stepped backward into the active decontamination wash area. Option B. Unrestricted zones allow normal street clothes. This option would be correct if the technician was walking through the facility's main visitor lobby to retrieve a coffee from the cafeteria on their lunch break. Option D. Fully restricted zones maintain the highest level of asepsis and strictly require surgical masks in addition to scrubs and hair covers. This option would be correct if the technician physically pushed the completed tray directly into an active operating room where sterile supplies were currently opened on the back table. Concept extension. If an unauthorized vendor attempts to enter the semi-restricted prep and pack area wearing street clothes, the technician must immediately halt their physical entry and require them to don a protective coverall, bunny suit and hair cover before proceeding. Question 60. While scanning the physical barcode of a 25-pound loaner spine set to log it into the electronic tracking interface, an SP technician understands this digital infrastructure provides massive logistical benefits. However, the technician knows the facility did not purchase this system to satisfy a mandatory physical requirement from which specific entities. A. Tracking the real-time financial depreciation and usage frequency of the items. B. Guaranteeing that circulating nurses can instantly locate the sets during emergencies. C. Complying with direct federal tracking statutes enforced by the CDC and OSHA. D. Assisting internal quality assurance audits regarding exact patient tray utilization. Correct answer C. Knowledge point explanation. Core rationale. Implementing an electronic instrument tracking system is universally recognized as a best practice for operational efficiency and patient safety. However, there are no specific legal statutes or federal regulations written by the Centers for Disease Control and Prevention or the Occupational Safety and Health Administration that physically mandate a hospital must utilize a computerized tracker over a manual paper logging system. Trap analysis. Option A. Monitoring instrument usage for financial management is a core operational reason facilities invest in these scanners. This option would be correct if asking how the department justifies the budgetary expense of purchasing new surgical power tools. Option B. Rapidly locating critical sets is a massive logistical benefit of the digital system. This option would be correct if asking how the software prevents fatal operating room delays during an incoming mass casualty trauma event. Option D. Linking a specific surgical tray to a specific patient is the primary quality assurance goal of the system. This option would be correct if asking how the department proves a specific biological indicator batch physically covers a specific patient's artificial joint implant. Concept extension. While not a federal law, facilities implement these systems to comply with the rigorous voluntary quality standards published by professional bodies like the Joint Commission and the Association for the Advancement of Medical Instrumentation. Question 61. While physically organizing the chemical storage cabinet in the decontamination area, an SP technician reviews the standardized safety data sheet for a newly purchased enzymatic detergent. Which specific piece of operational data will the technician be completely unable to locate within this mandated safety document? A. The precise physical characteristics and distinct odor profile of the liquid chemical. B. The exact minimum threshold of gallon jugs required to be kept on the facility's inventory shelving. C. The specific personal protective equipment garments mandated for safely handling the raw fluid. D. The exact proprietary brand name and the original manufacturer's emergency contact information. Correct answer B. Knowledge point explanation. Core rationale. A safety data sheet is a strict regulatory document focused entirely on the chemical composition, physical hazards, and safety handling requirements of a specific substance. It does not contain any operational or administrative inventory data, such as how much of the product a specific hospital should order or keep in stock. Trap analysis. Option A. Physical data like appearance and odor is a mandatory component of the safety document. This option would be correct if the scenario asked what specific information is physically detailed within Section 9 of the document. Option C. Special safety precautions and required protective gear are critical components of the document. This option would be correct if the scenario asked what specific handling instructions the technician must physically review in Section 8 before opening the jug. Option D. Product identification is the primary introductory requirement of the safety document. This option would be correct if the scenario asked what exact physical identification data must be verified in Section 1 to ensure the document matches the bottle. Concept extension. If a technician needs to determine the facility's required inventory levels for this detergent, they must physically consult the department's par-level logistical tracking software, entirely separate from safety compliance documentation. Question 62. When an operating room nurse aggressively confronts an SP technician at the dispatch window demanding a customized orthopedic tray that is currently still inside an active cooling phase, which specific behavioral response must the technician physically exhibit to properly resolve the high-stress interaction? A. Immediately adopting a highly submissive posture and actively agreeing to release the hot tray to appease the nurse. B. Halting all physical workflow to immediately summon the department director to handle the interpersonal conflict. C. Maintaining a completely calm vocal tone while firmly explaining the physical safety necessity of the cooling parameters. D. Raising their vocal volume to physically match the nurse's aggression and defend the sterile processing protocols. Correct answer C. Knowledge point explanation. Core rationale. Professional human relations skills dictate that sterile processing technicians must maintain a calm, professional attitude during difficult interactions. By controlling their emotions and firmly communicating the scientific reality that moving a hot tray causes physical condensation and catastrophic microbial contamination, the technician advocates for patient safety without escalating the conflict. Trap analysis. Option A. Releasing a hot tray guarantees physical contamination through wicking, severely endangering the patient. This option would be correct if the requested tray had already fully reached ambient room temperature and the nurse urgently required it for a trauma case. Option B. Technicians are expected to professionally manage routine workflow conflicts independently without instantly defaulting to management intervention. This option would be correct if the nurse physically bypassed the window barrier and attempted to grab the hot cart directly without authorization. Option D. Matching aggression completely destroys teamwork and instantly halts any effective operational communication. This option would be correct if the technician needed to shout to warn the nurse that a heavy wire rack was physically collapsing above them. Concept extension. A core element of employability is the ability to professionally de-escalate tension while strictly refusing to compromise on established infection control practices regardless of external surgical pressure. Question 63. While utilizing a handheld barcode scanner at the clean prep and pack workstation, the SP technician interacts with the facility's computerized instrument tracking software. Which specific combination of operational functions is the technician actively executing through this digital interface? A. Instantly locating specific physical trays, actively monitoring external loaner receipt times, and securely linking sterilization records to specific patients. B. Automatically adjusting the mechanical water temperature of the endoscope reprocessor and physically printing the daily human resources shift schedules. C. Directly transmitting instrument repair cost invoices to external vendors and tracking the continuous cardiovascular vital signs of patients in the surgical suite. D. Downloading the latest physical manufacturing blueprints for a robotic grasper and sending immediate operational text messages to the circulating nurse. Correct answer A. Knowledge point explanation. Core rationale. Comprehensive computer-based tracking systems in sterile processing departments are designed to manage internal logistics and quality assurance. Technicians use these systems to digitally ping the exact physical location of a tray, track the operational turnaround time of vendor loaners, and permanently tie specific sterilized loads to patient charts to manage future recall protocols. Trap analysis. Option B. Tracking systems document the workflow but do not mechanically manipulate the plumbing parameters of washing equipment or manage staffing schedules. This option would be correct if describing the separate functions of the washer's internal microprocessor and the hospital's dedicated timekeeping software. Option C. The software tracks internal repair frequency for budgeting but does not execute external vendor accounting or monitor live clinical patient health telemetry. This option would be correct if describing the facility's centralized billing software and the operating room's dedicated anesthesia monitoring system. Option D. The tracking system locates physical tools but does not access manufacturer design blueprints or function as a direct interdepartmental instant messaging service. This option would be correct if describing a biomedical engineering technical database and a distinct secure hospital communication pager. Concept extension. By accurately scanning every item at every workstation, the technician physically ensures the system can generate highly accurate productivity metrics, identifying workflow bottlenecks and justifying future staffing budget requests. Question 64. After being officially promoted to the role of lead sterile processing shift supervisor, a former frontline technician is physically rearranging the daily workstation assignment board. To succeed in this advanced operational capacity, the new supervisor must execute this physical task while continuously recognizing which fundamental leadership reality? A. Acknowledging that their interpersonal peer relationships will permanently shift and they must now prioritize the overarching workflow needs of the entire facility. B. Understanding that their new administrative title grants them absolute authority to unilaterally alter the biological indicator incubation protocols. C. Realizing that taking on a leadership role completely eliminates their personal requirement to complete annual physical competency training. D. Assuming that their new position strictly forbids them from ever physically stepping into the decontamination area to assist with manual scrubbing. Correct answer A. Knowledge point explanation. Core rationale. Transitioning into a management role requires a major perspective shift. The newly promoted leader must understand that they can no longer operate simply as a peer. Their workplace relationships will fundamentally change as they are now required to make difficult, unbiased operational decisions that support the broad quality and supply demands of the entire surgical facility rather than personal friendships. Trap analysis. Option B. No level of management holds the authority to violate the exact scientific parameters dictated by the manufacturer's instructions for use. This option would be correct if the supervisor was simply reallocating the timing of staggered staff lunch breaks to better cover the afternoon surgical rush. Option C. All certified sterile processing personnel, including directors and supervisors, must maintain and document their annual continuous physical education requirements. This option would be correct if the scenario asked what mandatory ongoing requirement is legally waived when a technician permanently retires from the medical field. Option D. Highly effective supervisors must remain fully capable of physically donning personal protective equipment and scrubbing at the sink during severe staffing shortages. This option would be correct if the supervisor was physically barred from entering the wash area because they completely refused to wear a fluid-resistant gown. Concept extension. A key component of successful promotion is accepting that even meticulously planned shift assignments will fail due to unexpected surgical traumas or machine breakdowns, requiring the supervisor to constantly adapt their physical plan. Question 65. While standing at the sterile storage dispatch window, an SP technician actively listens to a scrub nurse describe a unique instrument issue, physically nods in acknowledgement, and verbally asks precise clarifying questions to identify the exact missing clamp required. This complete, interactive physical process is the exact definition of which fundamental operational skill? A. The two-way interpersonal process of effective communication. B. The rigorous physical application of standardized moral behavior. C. The execution of a singular, unidirectional verbal feedback loop. D. The strategic external deployment of cross-functional team networking. Correct answer A. Knowledge point explanation. Core rationale. Communication is strictly defined as the active process of transmitting information and understanding from one person to another. By utilizing both physical body language like nodding to show active listening and verbal follow-up questions to gather exact details, the technician successfully completes the two-way cycle required to genuinely understand the nurse's immediate clinical needs. Trap analysis. Option B. Moral behavior governs doing the right thing regarding ethics, not the specific mechanical mechanics of information exchange. This option would be correct if the technician actively refused a bribe to illegally skip the leak testing phase on an arthroscope. Option C, feedback is only one half of the interaction. True communication requires both the initial transmission and the confirming response to achieve total comprehension. This option would be correct if the scenario only described the technician silently nodding their head without asking any questions to verify the actual tool requested. Option D, networking involves building long-term career relationships outside normal daily duties. This option would be correct if the technician was actively introducing themselves to various hospital directors at a nationwide sterile processing educational seminar. Concept extension. Effectively employing this communication loop directly prevents severe operational errors, ensuring that the technician physically pulls the correct Kelly clamp rather than a superficially similar cryo clamp, saving critical operating room time. Question 66. While physically unboxing a new shipment of concentrated enzymatic floor cleaner for the decontamination area, an SP technician needs to file the required regulatory paperwork regarding the product's chemical hazards. Which specific entity is legally responsible for physically authoring and supplying this mandatory safety data sheet? A. The Federal Occupational Safety and Health Administration. B. The Federal Food and Drug Administration. C. The facility's Internal Risk Management Committee. D. The original product manufacturer of the chemical. Correct answer D. Knowledge point explanation. Core rationale. While government agencies require safety documentation to be accessible in the workplace, they do not create the documents for individual products. The manufacturer who physically formulates and produces the chemical is legally obligated to author and provide the safety data sheet detailing its specific hazards and handling instructions. Trap analysis. Option A. This agency mandates that the sheets be available to workers, but does not write them. This option would be correct if the scenario asked which federal body enforces the workers' right to know laws regarding chemical exposure limits. Option B. This agency regulates medical devices and chemical sterilants, not environmental floor cleaners or safety data sheets. This option would be correct if the technician was reviewing the clearance documents for a newly purchased Class II biological indicator. Option C. Risk management uses the provided sheets to build internal hospital safety policies. This option would be correct if the scenario asked which internal hospital department physically designs the emergency evacuation routes for the sterile processing layout. Concept extension. If a chemical shipment arrives without a safety data sheet, the technician must physically quarantine the product and contact the manufacturer to obtain the document before anyone is permitted to use the cleaner. Question 67. An SP technician is seeking a promotion to a shift lead position and has scheduled a formal meeting with the department director. While preparing at home the night before the physical interview, what critical preparatory step should the technician execute to ensure professional readiness? A. Reviewing the multiple choice questions from their initial certification examination. B. Drafting a written physical essay to respond to the original digital job application questions. C. Anticipating possible situational questions and verbally practicing their responses. D. Memorizing the exact serial numbers of the facility's steam sterilizers to impress the director. Correct answer C. Knowledge point explanation. Core rationale. Career advancement requires strong communication and human relations skills. An interview is a dynamic verbal exchange. The most effective preparation is anticipating common behavioral or situational questions, such as how to handle a conflict with an operating room nurse, and structuring thoughtful, professional responses beforehand. Trap analysis. Option A. The certification exam proves baseline knowledge, which is already established if they secured the interview. This option would be correct if the technician was studying for their annual competency renewal test. Option B. Interviews are live verbal interactions, not written physical tests. This option would be correct if the technician was in the preliminary phase of logging into the Human Resources portal to submit their initial resume. Option D, rote memorization of equipment serial numbers demonstrates no leadership or problem-solving capability. This option would be correct if the technician was filling out a biomedical engineering repair ticket for a broken machine. Concept extension. Preparing concrete examples of past physical actions where the technician successfully improved workflow or resolved a decontamination bottleneck will heavily support their qualifications for a supervisory role. Question 68. After physically unloading a heavy carriage from a 270-degree Fahrenheit steam autoclave, an SP technician sits at the computer terminal to complete the mandatory cycle documentation. To ensure accurate patient traceability, which specific physical data point must the technician accurately log into the sterilizer record? A. The specific brands and models of the physical monitoring sensors built into the machine. B. A detailed inventory of the exact items and quantities physically processed in that specific load. C. The historical dates of the last 3 preventative maintenance routines performed by engineers. D. The atmospheric barometric pressure of the surrounding clean preparation room. Correct answer B. Knowledge point explanation. Core rationale. A sterilizer load record serves as the legal and clinical bridge between the sterilization equipment and the patient. Documenting the exact items and quantities allows the facility to physically track exactly which instruments were exposed to that specific cycle, which is absolutely critical for recalling compromised trays if a biological indicator subsequently fails. Trap analysis. Option A. The record must include the actual printout values of time and temperature, not the brand names of the gauges measuring them. This option would be correct if the technician was filling out a capital equipment purchasing request for replacement parts. Option C. Maintenance logs are vital but are physically maintained in a separate engineering binder, not attached to daily individual patient loads. This option would be correct if a Joint Commission surveyor asked for proof that the sterilizer was being serviced according to manufacturer guidelines. Option D. External room pressure does not belong on a sterilizer cycle log. This option would be correct if the technician was logging the daily environmental HVAC parameters for the sterile storage space. Concept extension. Alongside the item quantities, the technician must also physically attach or scan the lot control number, the sterilizer machine number, and the results of any chemical or biological indicators run in that batch. Question 69. Before physically installing a newly purchased automated endoscope reprocessor into the washroom plumbing, the SP management team gathers to systematically predict what mechanical failures or user errors could possibly occur during its future operation. By actively trying to identify and mitigate these physical risks prior to their occurrence, the team is utilizing which specific quality tool? A. A reactive root cause analysis. B. A comprehensive failure mode and effects analysis. C. A routine daily environmental monitoring audit. D. An after-action critical incident review. Correct answer B. Knowledge point explanation. Core rationale. Failure mode and effects analysis is a proactive, forward-looking quality management method. It is used before a new process or machine goes live to systematically brainstorm every potential physical failure point, the modes, and evaluate their consequences, the effects, allowing the team to build safeguards before a patient is ever put at risk. Trap analysis. Option A. Root cause analysis looks backward at an event that has already happened to find the fault. This option would be correct if the team was investigating why the newly installed reprocessor had just flooded the decontamination floor. Option C. Routine monitoring is the daily verification of ongoing processes, not a specialized predictive analysis tool. This option would be correct if the technician was logging the physical temperature of the water flowing into the reprocessor sink. Option D. An after-action review is performed post-incident. This option would be correct if the team met to discuss how they handled a recent facility-wide power outage. Concept extension. A resulting safeguard from this analysis might include installing a physical backflow preventer valve on the waterline or creating a mandatory checklist for technicians to physically verify the chemical dosing tubes are connected properly every morning. Question 70. A hospital utilizes a dual cart logistics system for its busy maternity ward, where an SP technician physically pushes a fully restocked cart up to the floor every morning to swap it directly for the depleted cart from the previous day. While highly efficient for the nursing staff, what is the primary physical and administrative drawback of operating this specific exchange cart replenishment method? A. It physically restricts emergency room access because the carts cannot roll through standard doors. B. It is restricted to transporting items exclusively for a single, designated surgical procedure. C. It mandates that the facility purchase and physically store duplicate levels of inventory. D. It forces technicians to manually reorder consumable supplies multiple times per shift. Correct answer C. Knowledge point explanation. Core rationale. The exchange cart system relies on having two identical carts for one clinical location. While cart A is being used by the nurses on the floor, cart B sits in the sterile storage area holding an identical, fully stocked physical inventory waiting for the next day's swap. The major disadvantage is the significant financial cost and spatial footprint required to physically purchase and house this duplicate inventory. Trap analysis. Option A. Exchange carts are standard-sized and used throughout various departments. This option would be correct if describing a highly specialized, oversized MRI machine that cannot fit down certain hospital corridors. Option B. Carts designated for a single surgical procedure are defined as case carts, not exchange carts. This option would be correct if the technician was physically pulling instruments based on a preference card for a scheduled appendectomy. Option D. Exchange systems actually reduce daily reordering labor, as restocking is centralized and predictable when the depleted cart returns. This option would be correct if the floor utilized a poorly managed requisition system with no par levels, causing them to run out of supplies constantly. Concept extension. To optimize this system, the SP technician must diligently track which items on the returning cart were consistently in use, allowing management to lower the par levels and physically remove unnecessary weight from the daily transport.